roads are becoming safer, as a new report is showing consistent decline in deaths and accidents on the roads within the capital. Now, knockdowns, though, continue to increase. These are actually the findings that we're seeing in a new report released by Bloomberg Philanthropies Initiative, and the reports carried out in collaboration with the Accra Metropolitan Assembly reveals that weekends are the most dangerous on Accra's roads, with 47% of deaths occurring on the weekends.
Great. So in terms of the key findings, we observed that in the year under review, which is 2022, compared to the previous year, 2021, we realized that overall crashes reduced by 22%. Similarly, death also reduced by 17%. And what is quite interesting is that in that same period, speeding recorded in Accra also reduced from 50% in 2021 to 43% in 2022. So clearly, you can see that in that same period, road crashes and its associated deaths reduced. So you see a strong correlation between speeding and severe road crash outcomes. So that's one of the key findings. So in 2021, there was 123 road deaths, and if you compare it with the 2022, it's reduced to 102 overall deaths that was reported. Because there are instances where the fatalities or road crash occurs and the victims involved decide to kind of like have an out-of-court settlement. So we are very careful in saying reported road deaths that have been given to the police. So these are the indicators or the outcomes that we found in the data. And if you look at it in terms of the road user types, we saw that 77% of the fatalities was recorded among the vulnerable road users. And when we say vulnerable road users, we are looking at the pedestrians, the motorcyclists, and the bicyclists. They are vulnerable because on the road space or on the road corridor, they don't have any covering, sort of a space covering them, unlike vehicle occupants who are in a more safer or more confined space. So for vehicle occupants, you realize that they accounted for a lesser amount of road there, which was 23. And that is a typical picture that we see in most urban spaces, because the vulnerable road users are these people who are very less protected, let me say. Unlike on the interlands, on the highways, from intercity highways, you realize that whenever you hear of a road crash, these are victims in a bus. And that's why we record more fatalities on these intercity highways among vehicle occupants as compared to in the city or urban space, where these vulnerable road users rather account for most of these fatalities.
Well, let's have a conversation on the back of that. Joining us is Dr. Raphael, Regional Technical Advisor for the Africa on-road injury surveillance at Bloomberg Philanthropies, and also Ebenezer Kofi Beidou is road injury surveillance coordinator in Accra for Bloomberg Philanthropies. And thank you, both gentlemen, for spending some time with us here. And we've seen, you outdoor this report. I believe that's what you're holding with you now. But why is this significant for road safety?
Okay, so thank you for the question. There's a saying that before you can manage anything, you have to measure it. And without data, you can't make any informed decision.
Right.
So in our space within road safety, before we undertake or execute any form of intervention, we should be able to understand the context, the magnitude. Is it really too severe that we need the needed attention? So with the data, it points to us who is most vulnerable, when are even the risk periods, as well as the high-risk locations, to help us then streamline our effort to address these fatalities and crashes in these locations.
So what are the key findings in this document that the general public should be concerned about?
So the report, as you rightly said, was outdoor today, and the main findings are that we've seen a decline in the number of people who are dying on the roads of Accra. We've also seen a decline in the number of crashes, 17% and 22% respectively. However, we are very cautious about this. We don't want to, sound the trumpet of victory yet, because we still see that pedestrian deaths are still high, and pedestrians make up the majority of those dying on the roads of Accra. So these definitely are the key findings. Another key finding is the fact that we see, and we've seen this trend over the last 5 years, those aged 20 to 29 have the highest proportion of deaths. And these are people who are young people in school who just started life, about to start a family, and so on and so forth. So it definitely has implications for economic burden and so on. And then also the high-risk locations. There are specific locations in Accra that are high risk for fatal crashes, particularly the N1 corridor. There are various spots there that have accounted for a majority of the deaths. And then finally, a key finding is that we see a decline, a very steady decline in speeding prevalence in Accra. Nonetheless, it's still high at 43%. What it basically means is that if you take 10 vehicles, 4 of them were observed speeding above the posted limit. So these, in a nutshell, were the key findings from the report released today.
And you talk about weekends in the report. How are they becoming a safer spot or period, or rather a danger to road users?
Yeah, so for the weekend crashes, it's quite interesting. The analysis we conducted, we realized that there were more crashes reported during the weekdays as compared to the weekends. And in terms of the fatal ones, or the most severe ones, we recorded more of these fatalities. In fact, nearly half, given the reference year 2022, during the weekend. And one of our partners, they conduct observational studies on speeding. That's the Johns Hopkins International Injury Research Unit. Right. They have an independent study actually they conducted in the city of Accra, showed that vehicular speeds are twice frequent during the weekends as compared to the weekdays. So clearly, the main underlying risk factor here is speeding. And as Dr. Iwo rightly said, when we observe that vehicular speeds reduced in that same year period, crashes and related deaths also reduced. So there are a number of factors that could be attributed to this decline. Right. First of all, we look at during weekend, we know there's some sort of reduced enforcement within that period, and also some other behavioral risk factors like drink driving over the weekends. As we know, Ghanaians, we don't joke with our social events. So upon returning, some people try to get tipsy, and on our highways, realize that during low vehicular flow, people think there's enough space on the road.
Right. So what are the recommendations then, and what should we be looking forward to?
Sure. So first of all, what we are saying is that we need to prioritize pedestrian safety in Accra. The profile of deaths, road traffic deaths in urban areas is definitely different from non-urban areas. In urban areas like Accra, we are seeing that a lot more pedestrians are accounting for the death. So the first recommendation is we need to prioritize pedestrian safety. The good thing is that there are low-hanging fruit. So there are things or activities or actions that can be done that are low cost but high impact. For example, providing designated crossings for pedestrians, freeing pedestrian walkways from obstacles and so on, implementing speed calming measures in high pedestrian areas and so on. So definitely improving pedestrian safety has to be at the forefront of any interventions that we want to implement to improve outcomes.
Is there any word to the people out there on how they can actually find the report, perhaps other groups that you're seeking to work with on this note?
Okay, so for the report, with the initiative, we're working on this road safety initiative. We work closely with the Accra Metropolitan Assembly, so on their website it's available for all of them. Right. And just finally, I would want to say that there's a saying among those of us in the road safety space that road safety is a shared responsibility. So it's high time that we recognize it as a public health issue, requiring organized community effort to address this menace that we have. Yeah.
Dr. Ralph, any final?
I would say that we have limited resources in this country. There are a number of things competing for the limited resources we have. And one of the ways we can address these preventable deaths and injuries is relying on the data, using the data to inform decisions, because then it guides you specifically on things that you need to do. So those would be my parting words.
Well, and I'm grateful, Dr. Ralph Ebenezer, for joining us in studio. And you're still with us here on the Pulse on the Joy News channel.